This conference will now be recorded.
Good morning, everyone. Today we'll discuss about diathermy and other energy sources in surgery. So, what are the points to be discussed today? That is introduction of diathermy, biophysics of electrosurgery, bipolar electrosurgery, monopolar electrosurgical techniques, risk reduction strategies, harmonics, and other energy sources. We shall not discuss all the topics, but we'll cover up to the maximum. So coming to the introduction, first, why do we use electrosurgery? Why do we need electrosurgery, diathermy in surgery? To basically to control the bleeding. Okay, that is the main purpose of electrosurgery. In previous days, they used to tie the knots, tie the bleeding vessels using the help of threads or silk or any other material, suture material. So nowadays, in order to conserve the usage of suture material and also to conserve the time of surgery and also to reduce the time of surgery, we go for cautery usage of electrosurgical devices. So that is the main purpose of diathermy in surgery. So Egyptians are the first to use cautery to treat patient conditions. So Hippocrates described the application of red hot iron instruments to cauterize and suppress hemorrhoids. This is the first usage of cautery in surgery. So basically he used to cauterize the hemorrhoids. So in 1900 they discovered that variations of high frequency could result in different wavelength resulting in different tissue effects. So water decaying heart and Seymour Pause used the term fulguration from the word fulgur, which means lightning. So when we put cautery, there will be lightning in the surgical field. So we call it as fulguration. Okay. So in 1909, they described the coagulation from the Latin phase using the indicating to cuttle. So the first experiment with bipolar coagulation using a second electrode. So we use monopolar and bipolar. So first time in 1909, Doyen used the second electrode, considering it as the bipolar instruments. So this innovation was referred to as an indifferent electrolyte and later became used as a patient-return electrolyte. Despite the effort of so many, the technology is mostly closely associated with T. Bowie and Harvey Cushing. So biophysics. So we cannot escape from these topics because these are the must and should in surgery. So these are the important questions also. So biophysics. So coming to physics, electrosurgery is the application of high frequency alternating current delivered into biological tissue, resulting in a desired clinical tissue effect. So in physics, in intermediate, you might have learned that alternating current goes and comes in the form of single waveform. So similarly, we are using that physical application in the surgery. So high frequency electrosurgical devices operate in the range of 200 kHz to 3.3 megahertz. So the tissue effect depends on the concentration of energy, amount of time applied, and electrical property of the tissue. Sometimes the tissue might require more amount of alternating current and energy applied. So in deeper solid organ tissues, they require more. In the hollow viscous organ tissues, they require less amount of energy and less amount of time. So varying upon the tissue, the application of the diathermy is also varied. So when applied correctly, the clinical endpoint is of desired tissue effect will result in controlled cutting and dissection of the coagulation. So although used interchangeably, electrosurgical is not as electrocautery. So electrocautery device delivers direct current through a heating element such as a probe or wire intended to cauterize the tissue. The patient's body is not part of the circuit. Electrocautery has a limited application and does not allow for cutting, dissecting, or the coagulation of the large vessels. So electrosurgery utilizes the electromagnetic energy through tissue to produce heat, resulting in the desired tissue effect. During electrosurgery, the patient's body becomes part of the electrosurgical circuit. So bipolar electrosurgical is a use of alternating current in which the circuit is confined within an instrument using two adjacent poles one positive and one negative, located in close proximity. Current flow is restricted between these two poles. So the instrument will be having the two electrodes. So we'll be holding in our hand the two electrodes, and when we apply it to the tissue, the current passes from the one electrode to the other electrode. So the current will be, the flow of current is between these two poles and across the tissue. So it won't traverse across the body. So in between these two tissue only the current is limited. So this is the physics of bipolar cautery. So there will be a variety of bipolars such as instruments, forceps, scissors, graspers. These are the various types of bipolar instruments. So most bipolar instruments are use a low voltage waveform that achieve hemostasis without unnecessary charging. So the other side tissues or other adjacent tissues will not be involved. Only the tissue between the two electrodes are only involved. The patient return electrode is not needed when bipolar is used because fan flow is confined to the tissue between the poles of the instrument. Advantage is it is safe, and it is also safer in patients with pacemakers and implantable cardioverters and defibrillators. Generally, electrosurgical device they are contraindicated in patients who are on cardiac pacemakers or who are defibrillators, implantable defibrillators, because the current which passes across the body traverses into the pacemakers and causing different waveform pattern and different current impulses released from the cardiac pacemakers. So heart to causing the heart to change out of its pattern of heartbeat. So these are more safer in bipolars are more safer with pacemakers and are more powerful monopolar. Electrosurgical units may be dangerous. So this is the bipolar. So in this picture, we can see the two poles. That is these two are the two electrode poles. Those are directly connected to the diathermy device, and the tissue the surgeon is applying to the tissue that requires to be cauterized, and the current is limited between these two electrodes only. Okay. So monopolar, coming to monopolar, the most frequently used method of delivering electrosurgery is monopolar because it has a great range of tissue effects and it is also more powerful than the diathermy, bipolar. So this is the process. So the power is generated in the electrosurgical unit and it is passed into the active electrode through the wires that are connected between the electrosurgical unit and the electrode pen. So from the active electrode, it passes into the patient tissue, and it acts on the tissue material, causing charring of the tissue. From there, the current passes into the returns back into the electrode and into the electrosurgical generator. So this is the electrosurgical device from where the electricity or the current is generated, and it passes through the wire into the electrode pen. The patient surgeon is holding the electrode device, and the charring occurs, and from there the current passes into the back into the electrode unit, and from there it passes back into the electrosurgical device again. So this is the process. So the in the bipolar device, so both the current passes between these two electrodes only, but in monopolar it passes from here to the other electrosurgical active electrode. So current output waveforms. So electrosurgical generators allows for the current output to be modulated, resulting in different waveforms. That is, 4 different waveforms often include cut, blend, coagulation, and hemostasis with dissection. And the resulting clinical effect on the tissue is determined by the application of specific waveform. So current output waveforms, clinically application, cut mode and coagulation mode, sulfuration mode. So coming to cut mode, apply the non-contact cut technique by placing the active electrode above the tissue with continuous movement. So this allows for the low voltage current to cut tissue with minimal hemostatic achievement. Okay. So coming to the clinical, apply contact cut technique directly to the tissue for immediate hemostatic effect, and that contact technique is referred to as the desiccation. So blend mode. Coming to the blend mode, select blend mode when hemostasis is desired when cutting And blend mode can be utilized when low voltage coagulation is desired, such as during the laparoscopy. So, clinical application, coagulation mode. Apply the spray coagulation mode for oozing tissue sets and or larger superficial surfaces. During laparoscopic procedure, the use of low voltage coagulation reduces the potential for insulating failure and capacitive coupling. So, this is the current output waveform. So, in this, the cut and the coagulation modes are present, where we monitor the basing upon the amount of current required for the tissue sharing. So variable influencing tissue effects. Coming to power setting, always select the lowest power setting to achieve the desired tissue effect. And power setting should be determined by the individual patient characteristics. Muscular patients who are of appropriate height weight will require low power setting than those of obese, because the fat tissue requires more of the current effect. So it will be absorbed by the adjacent fat tissue in the obese patients, whereas in muscular patient the tissue muscle tissue directly receives the current. So less amount of energy is required. So coming to the patient, returning electrode should be placed as close to the surgical site as possible, because if it is placed far away, the current should pass all over the body and to the other surgical site, so other electrode site. So the tissue may be affected in between these two. So greater the distance, the more impedance there will be encountered, requiring a higher power setting to achieve the desired effect. To minimize the impedance, placing the patient return electrode on a large vascular muscle. So application, coming into the time of application. Dwell time is the length of time the active electrode is in contact with the tissue. Long activity time will increase the risk for unintended thermal injury. So minimal short pulse activities should be present. So at a stage you should not put the long activities or long thermal, long application of the current to the tissue. So in short pulses only we should apply. Too short of activation time may result in absence of clinical tissue. So not too long or not too short. It must be in medium process only. Okay. Variable influences. To achieve the desired tissue effect, appropriate power setting, observation of the tissue effect, and appropriate dwell time is also essential. So coming to tissue conductivity, patient tissue type, muscle and fat result in various impedance to the flow of electricity. A patient who is muscular with minimal adipose tissue will conduct the current flow better than an obese or emaciated patient. So coming to the surgical techniques, appropriate tissue effect is achieved with the combined art and science of electrosurgery. It includes surgeon's knowledge of electrosurgical principles and application. So skilled application, appropriate selection of the current output waveform, lowest power setting, avoidance of long dwell times, and selection of appropriate electrode sites. So ground reference electrosurgical generator, wall output, from there the generator produces to the active surgical electrode to the surgical tissue site, and then it passes into the return electrode again back to the generator, and wall outlet it passes, and from there it is grounded to the earth. So this is the first generation electrosurgical device. Basically, previously they used to perform with this type of procedure where it passes back onto the ground. So major potential hazard with ground reference generator was the current could exit through an alternate pathway. It may be either through the patient and to the table, or it may exit back into the back from the generator. So there are two pathways for in this case of electrosurgical device. So it is not that much safe. So current division allows the current to deviate from the intended pathway to an easier pathway to return to the ground. If the current becomes significantly concentrated at an alternate exit site, an injury will occur. Similarly, thermal injuries will occur in this case of generators. So at the alternate exit side, if there is no proper protection or if there is it exposed to maximum to the ground, then there will be charring of the tissue. So what happens if there is alternate side of exit? So this is the alternate side burn, where you can see the electrode, the current passes through the electrode, the ECG lead, where it causes charring of the tissue. So these are the complications. So ground reference electrode surgical other potential hazards include the lack of an alarm in the event of the patient returning electrode was not attached to the unit or on the patient. Later models included a card fault alarm that activated if the patient return electrode was not attached to the unit. Due to safety issue, ground reference generator which have been placed with isolated generator system. So these generators utilize the isolated circuit designed to prevent current diversion. So isolated generators allow current to flow from the wall outlet to the generator, active electrolyte, that is the pencil held by the surgeon, and then through the surgical tissue, and it returns back to the so this is organ enhanced electrophysical device. Now we will use latest. So what are the hazards of endoscopic monopolar? Direct coupling, insulation failure, capacitive coupling, residual heat injuries, endosurgical smoke, and electromagnetic interference. So active electrodes and cannula system are divided into four zones. That is zone 1, the small area at the tip of the active electrode. and the only area in the direct view of the surgeon. Zone 2, the area just beyond the active electrode tip to the end of the cannula outside the surgeon's view. Zone 3, the area of the active electrode covered by the cannula system and also by the view of the surgeon. And zone 4 is the portion of the active electrode and the cannula that is outside the patient body. So these are all not required, but you have to know that in advancements what these are the hazards. So these are the various zones: zone 1, zone 2, zone 3, and zone 4. So what is direct coupling? This occurs when the active electrode is in close proximity or in indirect contact with the other conductive instruments. For in case in laparoscopy, this direct coupling occurs. Okay, these are the side effects, or this is the complication in laparoscopic surgery. So this is the direct coupling where the tissue, the active electrode, that is the current passing electrode, is in direct contact with the tissue. So that side where the electrosurgery is required and other side is also getting charged along with this tissue. So this is called as direct coupling. So what happens when the insulation failure occurs? So the insulating coating of the active electrode is compromised. So it is caused due to rough handling, usage of high electrode, high voltage electrosurgical current, damaging during the instrument cleaning, during repeated insertion into the cannula. So this happens when the insulation failures. That is, the electrosurgery is the case of cholecystectomy, cholecystectomy is done, and the electrosurgery is applied on the bed of the gallbladder and the liver, and also the bowel is also getting charred along with the bed of the gallbladder where the surgery is performed. So two sides are getting charred, and the bowel is also getting damaged due to the electrosurgical device due to the failure of the insulation. So risk reduction strategies. There are some steps perioperatively personnel and surgeon can take to reduce the risk of patient injury during laparoscopic use of electrosurgical device. That is, inspect insulation carefully and use the lowest possible power setting. Use the low voltage waveform. So use brief intermittent activation versus prolonged activation of the active electrode. Do not open air activate the active electrode, and do not activate the active electrode in close proximity or in direct contact with metal or conductive objects in the abdomen. Use bipolar electrosurgical whenever possible. So higher resection tissues such as scar tissue and bony prominence should also be avoided, and grounding pads should not be placed over metal processes because the scar tissue surrounding the implant increases the resistance of the flow of the electrical current. So the pad side should be clean, dry and free from excessive hair. The grounding pad should not be placed where fluids are likely to pool during surgery. The patient has a pacemaker. The return electrode should be placed as far from the pacemaker. So harmonics in surgery, the use of harmonics, but these are the advancements in surgery. So when ultrasound is mixed with the electrosurgical device, it is called as harmonic. It is refers to as the sound waves that have a frequency of more than upper limit of human hearing. That is greater than 20 kilohertz. The 23 to 55 kilohertz is used for surgical cutting, coagulation, and QSAR. That is cavitron ultrasound surgical aspirator used in liver dissection. So the spectrum of tissue effects can be achieved in the absence of the electric circuit. Ultrasonic transactional coagulation achieved via mechanical oscillation. So ultrasonic energy becomes standard operated tool because of its versatility, effectivity, and safety. So what is the mechanism of action? These are all that much of not required for you, but I am explaining this one. I am telling this topic because it may be something used to your age. That's why. So electric generator. From there, the alternate current is produced into the piezoelectrics in the transducer are excited. Conversion of the electrical to mechanical energy and mechanical oscillation occurs. Okay. The harmonics in surgery. The mechanical motion is transferred to the shaft where it is amplified by the silicon nodules, and the piezoelectric ceramic discs convert electrical energy into mechanical motion. So this is the harmonic that are used in surgery. The types of harmonic. They have curved blade type of harmonic, hook blade, and curved spheres. Okay. So generally we use harmonic in case of bowel, okay, and also in case of excessive bleeding sites, we go for harmonic. So advantages include reduced bleeding, faster recovery, precise cuts, very less lateral thermal tissue damage, less desiccation, and charring of blood vessels, less instrument and exchange during surgery. So, various fields where harmonics used are general surgery, plastic surgery, gynec, ophthalmology, urology, and otology, ENT. These are the various places we go for harmonics. Okay. So, later these are one of the advancements which use photons to excite the chromophore and molecules with tissue generate and kinetic energy that is used as heat. Okay. So, if this effect occurs without much collateral damage, in the case of harmonic electrosurgical device, other monopolar and bipolar, collateral damage will be present. But in case of laser, only the affected tissue or the pointed tissue that is required for the resection is injured. Okay, the most common lasers are argon, carbon dioxide, Nd:YAG, that is neodymium, yttrium, aluminium, garnet lasers. Okay. The depth of energy penetration within the target is least with the argon laser, moderate with carbon dioxide, and deepest with Nd:YAG. So we prefer Nd:YAG in case of deep tissue or maximum amount of or larger amount of tissue required for resection. So interstitial laser photocoagulation is more recently adopted laser treatment. Okay. So that much of not required, but you have to know whether the usage of the this one. Okay. Other is radio frequency ablation. So energy can be used for tissue ablation or curative or palliative treatment of different cancers. That is neuralgia, bone pain, and cardiac arrhythmia. Okay. So the temperatures greater than 100 degrees can cause protein denaturation, desiccation, and coagulation necrosis. Okay. So all are not important, but you have to know in brief. Better to know in brief than in going into depth. Okay. So this is the use of radio frequency ablation. The ultrasound probe is placed over the affected site, causing the waveform ultrasound waveforms to bombard the affected tissue, causing the necrosis of the tissue, tumor with surrounding, and then it is aspirated using the radio frequency other probes. Okay. So cryoablation, this is the one of the advancement in dissection, that is it causes freezing and thawing where the liquid nitrogen is used, which causes minus 35 degrees centigrade or lower for the damage of the tissue. Okay, it causes freezing of the cell, causing the degradation, and then thawing process is done. So cryoablation, it is used in hemorrhages, tissue fractures, and it is a major disadvantage of interstitial cryotherapy is its cost effective procedure. So they need general anesthesia for this procedure. It is currently used to treat solid tumor, lung, liver, breast, kidney, and prostate. So radiosurgery, this is the another gamma knife principle is used in neurosurgery. So you may not require this much of it. Okay. So thank you.